again. And Tim, so I'm going to say really warm welcome to you, and maybe a little context in the background of how we know each other. I know it's been a while. We've known each other for 15 years, and initially we were involved with when I was with your work on the Center for Understanding Sustainable Prosperity. That was your work, and my work was with working at WWF at the time, leading the Finance Innovation Lab system-wide change program. So I think what we had learned during that time in those early days of systems change is if you really want to understand the system, you have to understand the bigger picture context, understand the dynamics, understand the root issues, understand the history and the purpose and the values that shape that system. So I know I've been having chats with you recently, and I think that was why it was so important for me to bring your work to the Q community. And I think it's so essential for all of us who are interested in transforming and improving the health and care system. We really need to take that step back to understand all those things that influence the system so we can build better strategies for change. So I hope that's what all of you take away from today, is just a bit more insight and what the underpinnings which might be shaping the system that we're all seeking to improve and transform for all of our patients and staff and the health of the UK. So welcome, Tim.
Yeah,
Yeah,
thank you, Jen. It's great,
yeah.
great to be here. It's kind of weird in a way. I mean, maybe we do start with the obvious, which is that there's a red alert by the health authority over the next 2 days because of extreme weather, and that extreme weather is being exacerbated by climate change. Climate change was one of the environmental sustainability issues that I kind of worked on. Well, I've worked on for kind of 40 years, and was sort of the work that we came together with as well. So it is a sort of an irony, but also a blessing that we're having this online rather than physically in the middle of London somewhere where we'd be putting our health at risk. So thanks for enabling that.
Sure thing. Cool. Okay, so maybe, and those who are less familiar with your work, I don't know if anyone has read Tim's book, The Care Economy, or knows about your work. If you do, that's great. Glad you're here. But for those, I think, who don't are less familiar with your work, maybe Tim, you could start us off by maybe sharing a bit more about the origins and
Yeah, yeah.
the origin of the care economy and how you got here.
Yeah, I mean, it's not a million miles from that opening salvo, really. That idea that my interests arose out of the question of sustainability and the environmental impacts that the economy is imposing on the planet. Um, and in the middle of that work, at some point, figuring out that something like care, which is an activity that involves people's time and attention rather than the kind of endless throughput of material things, that actually leads you towards a cooler economy. It leads you towards a strategy for shifting your economy away from a materialistic economy that's growing forever and towards an economy that's about people, about relationship, about the services that we provide to each other as human beings. And the knock-on implications of that, as I kind of intimated previously, is that actually it has a lower carbon footprint, it has a lower material footprint because it's about people and services rather than products and material impacts and environmental emissions and climate change. So, in other words, as we kind of face things like climate change, the idea of the care economy became more important to my work as a sort of a focus for where does the economy go if its sole role is not just producing more and more stuff and providing more and more things and building more and more buildings, where does that economy go? Where does it, and what is it in the economy that contributes most to our quality of life? And increasingly, I began to feel as though actually this idea of the care economy, earlier on, actually, I called it the Cinderella economy. Um, because economists really don't pay that much attention to it. Politicians don't pay that much attention to it. I mean, that's not an unfamiliar statement or even contentious statement for the audience that we have today. But the attention paid by the economy, the mainstream economy, to this economy of service and relationship and care, it reminds you of that kind of story that it's kind of left behind while the ugly industries go to the ball and are over financialized and are supported left, right, and center, while the economy that really matters is kind of left home cleaning up the mess. And I mean, it's probably I'm not sure how politically correct the whole Cinderella analogy is, in fact, but I do like the idea that if you can put this idea of a care economy at the center of what we're trying to do, you get these multiple gains. You get, yes, it's a low carbon economy, it's a less materialistic economy. It employs people. The flip side of it being a place which requires attention is that it's very employment rich, so you can give people jobs. It's the bit of the economy that improves the quality of our lives, that is dedicated to improving the quality of our lives, not just to having more material things or to growing forever, but to improving the quality of our lives. And finally, and obviously this is a little bit contentious in the current circumstances, it's a bit of the economy where if you can get the conditions of work right, this is a more satisfying place to be, to spend your life's energy, to spend your life's work, than an economy that is simply about making more and more stuff, selling more and more things, throwing more and more things away, or engaging in the sort of winner takes all race of financial superiority. You know, you can make a lot of money that way if you're very, very lucky, while other people suffer. But in this economy, actually, you have meaning and purpose and the dedication towards of your life towards the service of other people, and that is a meaningful, satisfying place to be. So it has all these advantages that the care economy to me began to be a sort of, it came out. I didn't approach it from the perspective of health, but it came out for me as an obvious answer to the question, where does the economy go when it's stopped being a fossil fuel driven materialistic consumer society?
Mhm.
And I think it still remains a very good metaphor for that.
Yeah, yeah, that's interesting. So, what are the? I know I've read your book twice. It's so good, and I know one of the fundamental propositions you make is prosperity as health, and I think you're starting to allude to these things: prosperity as health rather than wealth. Could you dive into that just a little bit more and explain what you mean
Sure.
by that?
Yeah, I mean, this the work that I was describing, the environmental work. I carried out quite a lot of that work when I was the economics commissioner on the Sustainable Development Commission, and from very early on, this was back in the mid 2000s, I suppose, we had an inquiry going out. You know, what is prosperity? Everyone kind of cashes out prosperity, almost literally cashes it out in monetary terms. But actually, the roots of the word prosperity, prosperes, in accordance with speres, our hopes and expectations, in accordance with our hopes and expectations. It's a much more general concept. And so the idea of rethinking prosperity, as we were calling it at that point in the Sustainable Development Commission, redefining prosperity was a way into this critical subject of environmental sustainability, and it was a way of addressing that question. You know, the planet remains finite, the economy continues to grow. At some point, you know, the proverbial hits the fan, and that's the point at which you have to start looking at the economic model. But before you start looking at the model, let's look at what we think prosperity actually is. And in the process of that work, I mean, it was a lot of just from asking people, but also from looking at the literature, looking at the wisdom of the ages, looking at the poets, the philosophers, the religious leaders. What is prosperity? The conventional answer is prosperity as wealth, prosperity as money. But if you take this broader view, you step back a little bit and you ask people, what comes first at the top of those lists of those hopes and expectations? My health, my family's health, my neighborhood's health, the health of the planet sometimes. And so increasingly, I began to think, and it kind of helps that the two words rhyme with each other in English. They don't in every language, but they do in English. That, you know, prosperity as health is a much better metaphor. It's a convening metaphor for this debate in the way that prosperity for wealth isn't. And it teaches you something about the pursuit of prosperity. If you think of prosperity as wealth, that's all about having more and more. It's all about accumulation. It's all about increase. It's all about growth. But thinking about prosperity as health takes you in a very, very different direction, because health just doesn't work in that way. Health works always around ideas of balance, sometimes a little more, sometimes a little less, but never just growing and growing and growing. This sense that prosperity is about health brings you a new dynamic through which you can think about the economy, through which you can think about your life, actually. And it's a dynamic that's very much based around balance rather than about growth. And it points to you also why this growth-based dynamic continually gets things wrong, because if you think that prosperity lies in the direction of growing forever, you never think about anything but just growing, 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 more, more, more. And that means you never notice the point at which you've reached enough, at which you've reached that point of balance. And even if you do notice it, everything you've built, all the institutions, all the indicators, they are rushing past the point of balance and unable to turn you around. So this shift in metaphor, it's a very, very simple one, just one initial in the English language. It takes you to a very profoundly different place when you're thinking about the economy, what the economy is for, where it's going, and how it gets there.
Yeah, I think that really shifted how I see the world, even just, seeing what we mean by health and just that idea of balance. That's really helpful. It's helped me personally as well. And I know you've started to mention as well, like this other reframing around the other proposition, economy is care rather than growth. Is there anything, I know you've started to explain a little bit about that, but is there anything more you want to
Yeah,
share
yeah,
about the
yeah.
underpinnings of that?
And again, it was a sort of a thinking through this idea of health is, if health is about balance and growth is taking us the wrong way, then what is the dynamic? What's the lesson dynamically from that realization? And it takes us in a way to what care actually means. And I found this absolutely fascinating when I looked in the literature. You can look at the word care in all sorts of ways. We kind of overuse it a little bit. Sometimes it's just a sector in the economy. Sometimes it just proves that we are morally good human beings because we, quote, care for something or some cause. Um, Sometimes it actually can be almost oppressive, that caring for somebody or something can actually not be that much associated with health. So the word care is a difficult word when you want to use it in the sense of discovering what the economy might be looking like if it was a care economy. But the one thing that struck me, and it went back, it had all sorts of roots, not the least of actually was reading a little pamphlet called Notes on Nursing by Florence Nightingale, which was written back in 1859, in which she talks about what care is, and she talks about it really in terms of a kind of restorative force. If growth is the thing that gives you increase and wealth and accumulation and takes you out of balance, what is it that brings you back into balance? What is it that brings you back to health? And I think that's a very good way of thinking about what care is. Care is the restorative force that returns us back to the balance, which is health. And that again, I mean, in some ways, and I hesitate here because because I know that there are many people in the audience who will sort of understand that instinctively because you're working in that area. But actually, for an economist, it's a pretty fundamental revision of how you think about what the economy is doing, what we're doing, what people are doing, and what it means to think of prosperity as health. Is this idea of care as a restorative force, and to me that gave a lot. It gave again, a sort of direction of travel for thinking about where we got things wrong, but also how we can put them right.
Yeah, it's interesting. As I was contemplating that as well, just over the last few months and so, I do think like what we're doing in the world of improvement and trying to improve health and care is almost like a form of care. So in a way, I think what we're trying to do in improvement is to bring as a restorative force. We're trying to bring more health to the system in terms of how people relate, the processes, how we do things. So I think improvement in itself, in my mind, is a form of care. Bringing health to the health and care system.
Yeah, yeah, I really
So
like
that's
that. I think that's good.
yeah,
I think that's
yeah,
good.
yeah,
Um, and I suppose the suggestion there, implicit in what you're saying, and I sort of agree with it, is that the healthcare system itself is out of balance.
yeah.
So that, what is it that we're restoring? What is the balance we're restoring it to? And how is it out of balance? I think are really interesting questions to ask as well.
Hmm. Yeah. That might link to another thing too, in terms of this growth orientation, or this, sometimes you're saying care may not necessarily support our health. how does the growth orientation, undermine what we're trying to do? Why does this matter?
Yeah, and again, I mean, again, it's sort of and I talk about this quite a lot in the book, and you kind of go back into the history of medicine here, and you go back into the history of the healthcare system and how it developed, and the time at which it developed. Actually, much of what was happening in the early 20th century was about infectious disease and workplace accidents. And even actually when the NHS was founded, that's what the NHS was founded around. And the model that was built around Tredegar that is kind of the role model for the NHS. Um, and became the way that the NHS kind of came into existence directly because of the Nye Bevan, who was the MP for Tredegar in Wales at the time, came into Parliament as Health Secretary with this vision to create healthcare free for all at the point of need. Um, but the kinds of burden of disease, as it's called, that faced it at that time, arguably, you could get away with surgery and with some antibiotics and some pharmaceutical products that dealt with and were really good interventions in relation to communicable diseases. But that was a long time ago, actually. And in the interim, the burden of disease has shifted massively. And nowadays, the biggest burden of disease is from chronic non-communicable diseases. And those kinds of diseases are not so well amenable to pharmaceutical interventions or to surgery. In fact, when you get to surgery, that's the end stages of your non-communicable diseases. And when you get to pharmaceutical intervention, well, the pharmaceutical companies would like that as soon as possible, but then you're on that for life, essentially. And so these responses to non-communicable disease, these responses to the change in the burden of the diseases, they arrived with the kind of economy that we have, and they arrived with this growth imperative. They arrived with the idea, for example, that and you can trace the history of this quite precisely in the early 20th century, that the former big, well, they were called robber barons at the time, the Carnegie Mellons and the Rockefellers. They were looking for a market for something to sell once they'd more or less colonized oil and steel and railroads. And they discovered the idea that pharmaceuticals might be this market. And so there was a huge push. Capitalism itself built its kind of growth imperative in part through the pharmaceutical industry. And so we were left with a sort of over medicalized model of health. And that's not my quotation. That's actually a quotation from the personal physician to the royal household, an over medicalized version of the healthcare system. And the denigration of this idea of care. And when you look at it in its round, and you go back to the causes of those non-communicable diseases, many of them live with our diet, our nutrition, our lifestyle, our stress. And those things too are being kind of pump primed by the growth imperative. And most obviously, the fast food industry, which has expanded massively since the NHS was formed and is deeply implicit in this epidemic of non-communicable disease. So you have a fast food industry, and when you ask why doesn't anyone do anything about it, well, the fast food industry makes a lot of money. They campaign in Parliament to make sure that that industry is protected, is given special status, and is given privileges, given tax breaks, it's given the permission to operate. And that permission to operate, which is given by the government because the fast food industry promotes and provides the growth that government is desperately looking for, is undermining the public purse because it's creating and contributing to an epidemic of chronic disease, which then requires treatment. And from a growth orientation, that's fine because the pharmaceutical industry is also campaigning in government for protection of its status, and it can respond to that fast food crisis, that dietary crisis, by providing drugs which purport to ameliorate some of the symptoms of these chronic diseases, but never address the underlying causes. And all of it, and this is the punchline really, all of it legitimized because it contributes to growth. And growth is seen as the primary goal. If you see the primary goal as health, you're in a completely different place because you realize that both the food industry and the pharmaceutical industry and the healthcare system itself and even our lives are profoundly out of balance. And that's where care has gone missing.
Mm, yeah. It feels like as we make the shift to neighborhood health, shift to community, shift to prevention, looking at this wider determinants of health and really understanding health population outcomes, these kind of questions and the things you're sharing with us here are going to be so critical to bring in to get to those root issues and challenge vested interest and taking that wider view. Is there anything you want to say about what care is not, or do you feel like you've covered enough of that?
Um, yeah, I mean, I think in a way I sort of hinted at it, but I think it's the one thing that I find tricky about the use of the word care, and I sort of mentioned it before, is this idea that if you say you care, that's a good thing. And we use care in that way. And I'm not saying it isn't good to care. Of course, it's good to care, but actually, you know, I care for my kids by letting them eat sweets all day. No, probably not. I care for my patients by prescribing them opioids whenever they want it. Mm, no, probably not. I care for my political friends by sending them bombs to drop on the children of their political enemies. No, definitely not. And so we have to kind of get beyond a rhetorical use of care. And I think for me, that's where this really important idea of care as a restorative force, care that brings us back into balance, care that has health as its outcome rather than wealth and growth and expansion as its outcome. I think that's the distinction in a way that I drive through. And it was a distinction that I kind of discovered through the writing of the book.
Yeah, thank you. Okay, we've got about five minutes left, and maybe some of the questions just around like what, from all of this and what you've learned along the way, what do you think this means for all of us who are thinking about improving the health and care or thinking of reforming the health and care system? What thoughts do you have for us here?
Yeah, a really interesting question. And you mentioned, you've mentioned this before, that is beginning to become an important conversation. I mean, what's interesting, it's been an important conversation for well over a decade, probably a couple of decades at least, and quite often various reform processes, various things that the government has engaged in, things that the healthcare system itself, the reports around healthcare have engaged in, have mentioned it. That prevention matters, that primary care matters, that care itself matters and is being denigrated in the economic system because care workers are sort of second, third class citizens, and nobody really wants to do that work anyway. And so we palm it off to the people who least matter, and it becomes something really, really difficult to maintain. I'm characterizing in some sense, I'm caricaturing, but the really critical point is that we've had these conversations, we've had them for quite a long time, and things have not substantially shifted. And that must tell us really that there is a sort of structural dynamic going on which is more difficult. That isn't just, it's not, the NHS is full of desperately committed, well-intentioned people doing very, very difficult jobs under impossible circumstances. And yet, somehow, the burden that they're being asked to carry, the operational levers for that don't even exist inside the healthcare system itself. They exist outside, within the economy, within government policy, within the growth incentive that's supporting a whole set of industries that are undermining people's health and then asking the NHS to pick up the pieces and to pay for it. And I think this has to be sort of said. I think it has to be kind of out in the open because successive attempts by successive governments to reframe the healthcare system around the basis of improved operational efficiency or the introduction of AI technology or reform of administrations or a different management structure or operational indicators like waiting lists and beds in the ward, which are then the basis on which you're being rewarded by your budget, and your budget holders being the public purse. Here's some more money to do this, but only if you do that. None of that process is recognizing these broader drivers of the conditions of health, the terrain of health, as I call it in the book. And none of the operational ability lies within the healthcare system to shift actually any of those levers, because everyone is rushing the whole time to try and meet their indicators, meet their key performance indicators, and to keep people well and dedicated to doing their jobs in the way that we would want those people to be. And yet we're hampering them. Government is hampering them. The economic system is hampering them. Even to some extent, public opinion is hampering them. And certainly these drivers, these structural drivers of ill health, and in particular of chronic non-communicable disease, they are hampering that system. And we have to recognize, even if the healthcare system had as much money as it would like to have, that would not change these underlying conditions in itself. And so healthcare reform has to start and belong in the center of government, and it has to start and belong in the center of the economic system. And that's an argument that I think even Wes Streeting was not really making, and I haven't seen a health secretary make that argument in my lifetime, I would say. But it is something that has, in my lifetime, has gradually become the most important argument to make, I would argue.
Yeah. Okay, I hope you enjoyed your short conversations. I know we wish we had a little bit longer, but now's the chance to, I know we've got some questions in the chat already. Never enough time. I agree, Tracy. But yeah, hopefully this is the start of many more conversations to come on this. So now's the chance. If you just want to raise your hand, if you want to come in, any questions or comments or reflections for Tim, please do share. And Brian,
thanks,
maybe
Jen.
just say who you are as well. It'd be good to know.
Hi, I'm Brian Jones. I'm a senior fellow at the Health Foundation, and really interesting, Tim, again to hear what you've said. And I think in our conversation, I think one of the challenges here that this is too big, too difficult, and it's for so many people because it involves such a kind of fundamental reconceptualization of everything they've thought about care, how it's provided, what it is, that it gets marked in the box of this is, yeah, we can't deal with this. So I guess one of the challenges here, if you're in the front line or anywhere else in the system, at what level do you begin to kind of start to think about making change? How do you do it? Is it a question of kind of small incremental steps, gradually shifting people's perception if you're in the heart of service? And how then do you kind of think about the big macro questions of if you're a policymaker, which to make the kind of big shift, given there is so much invested here? So it's the kind of, I guess it's the starting point, because that's if we knew how to do that, we would have been in that situation already. But
yeah. Yeah, I guess that's true. I mean, we can know about things and still not be in a position to start if the incentive structures and the institutions are all pointing in the wrong direction and we don't have the power, or the people who do get the thing don't have the power in the situation. I did a piece of work recently where I was trying to distill, as you know, Brian, I was trying to distill some of this into the implications for a process of policy reform. And the one thing that I think would be kind of useful for people engaged in that process of reform is what I called a kind of policy test. Because when we have these reform processes and they're big and they're kicked off with a big fanfare by governments, and it gets very, very wide, and we have these big consultations, then we try and reframe, and sometimes out of that reframing come these directions that government themselves say, yeah, we're going to go in that direction, we're going to pay more attention to care in the community, we're going to bring in AI, we're going to look more at prevention, and then you have your three thrusts, and that ought to be where the reforms go. But when it comes to enacting policy changes, they quite often follow the path of least resistance, which is, let's get AI into everything and sell all our data to Palantir. Sorry, I'm mischaracterizing as something that isn't going on at all. It's not like that at all. AI can do some very good things, and technological improvement is really important with the healthcare system, but it doesn't really do justice to those fundamental directions that people already agree on. And it was just a suggestion really in this policy paper I did for the reform process in Scotland, NHS reform process in Scotland, a policy test. Does this intervention move institutions closer to prosperity as health, or does it merely cushion the costs of prosperity understood as wealth? Is it just clearing up the mess, or is it laying those foundations? We had someone in our little breakout room talking about, the flourishing of the population. Is this contributing to the flourishing of the population, or is it just something that is running after key performance indicators and lost goals and impossible challenges? And I think that if you go through some of the kinds of reforms that have been mentioned, you can then begin to sort of say, actually, this is going in the right direction. This is going in the wrong direction. This NHS operational recovery and improvement plans, well, they tend to be just about cushioning those costs. They're not addressing the underlying causes. Something around, food environment regulation reduces future harm in really, really important ways, but it doesn't exist as a healthcare reform policy. It has to be brought into the gambit of the conversation around healthcare reform. And so I think, I don't think there's a silver bullet. I don't think there's an easy way to address your question, but I do think this process of systematically examining those proposals and saying, which of these two things are they doing? Cushioning costs for an impossible system or changing the determinants of health? I think is a really important thing to be asking at every stage of engagement.
Thank you. Matthew, we've got a question from you. Come on in.
So I think my question is, because I'm quite interested in values research and so on, and I would say from the research that caring, and I put it in the chat earlier actually, is kind of the epitome of a value that's often held disproportionately by very universalist, inner directed pioneer type people. It's a key value, but it's not held by everyone at all. There's a lot of other more traditional, more materialist, more sort of outer directed, look at me and what I've achieved people. And I suppose my question for you is, have you thought about ways to wrap up the value of caring so that it appeals to people that kind of have the opposite values than you, that will appeal to their look at me and their, I just want to conform and very, traditional fitting in, because that's how you get things to spread. It's not really by reiterating a pioneer value. That's actually how you alienate people. I would argue.
I'm not sure that I agree with your idea that caring is a value held by a universalist, inner directed pioneer minority. I think the politicization of care, it falls very clearly into that, and I dislike it. I don't find it constructive. I think that actually the values of care exist within ordinary people, and I think you can make that argument in evolutionary ways. And quite often those ordinary people have no voice whatsoever, but they are still doing care. They are still engaged in care. And they're engaged in that sense that I tried to describe, of it being part of the process of restoring towards health, restoring towards balance. And all sorts of people are doing that in different ways. Some of them are caring for physical bodies, human bodies, living bodies. Some of them are caring for material bodies, the cleaners in the homes, who became actually incredibly important during the COVID pandemic, completely marginalized in society, are doing care. And so I think what I do try to do in the book, and I think is the important basis of this, is returning to the value of that process, of those jobs, of that activity, and saying this is not a marginal place of society. It is the most fundamental place in society. It's from this basis that we invest in everything. Without this care economy, there is no other economy. And so, you know, I think it's two things. It's recognizing that the care is a dirty job, actually, when it comes down to it, but that it is absolutely the most profoundly important job as well. And that's a different way of valuing care as a value than the one that says, look at me, how good I am.
Yeah, it's profound, Tim. Thank you. Paquita, I've got you next. Come on in.
Yeah, I had a conversation with Matthew and been mulling over it. I'm the chair of a charity called Human Values in Healthcare, and I also have a background in compassion focused therapy and work with Paul Gilbert. Now, I think the thing is that what is happening now is clearly not working. Everyone, I mean, so many people, whether how you measure it, are miserable, both in the healthcare sector and outside it. So I think this is actually quite a good time to reframe things and to recognize that, as was mentioned, evolutionary, we have a natural predisposition to show altruism and pro-social behavior and care. That was very evident to me. I live in the Grenfell neighborhood and was involved in the volunteering. I mean, the community just was out to care, to look after, to care. So it's something about the environment helping, enabling that natural predisposition. Okay, it varies from person to person. How can you expand the compassion repertoire? You know, it does require work. It does require listening and engaging in dialogue and so on. But, you know, I absolutely agree with what Professor Jackson was saying. And I know that, you know, we have also Hillary Cotter. We have so many people talking in the same way. And I think one way is that thing of belonging, because belonging can lead to tribalism, but it could also, if again packaged the right way, create that sense of care being an absolutely key element of creating that sense of interdependence and caring for each other and belonging. I don't know. I'm sorry, I'm just waxing on. And I love this idea of harmony, because after all, I'm reading a book called Wabi Sabi. That idea of harmony is very much in the East of finding balance. And again could be another way of bringing. So we are in a very unbalanced society and economy and healthcare. And we need to, and so many leaders in healthcare, and including politicians, they just use, you know, the old framework rather than seeing healthcare as a complex system, which requires a systemic approach. Sorry, that's me.
Thank you. And Tim, just to let you know, we've got about 4 minutes left, and there's another 3 questions in the queue.
Should we just take the questions? Yeah.
Yeah, why not? Let's do that. Thank you, Paquita. So Andy, you were next, and Christopher, then Gemma. Keep it succinct. That'd be really helpful.
Yeah, I've been doing a lot of work on this notion of human flourishing, broadening the conception of health, because we think about our National Health Service. It really is a national sickness service, and most health and care is trying to fix problems rather than prevent them from happening in the first place. And one of the things that's, as I've lent into that, is this: we don't really understand what it is that human flourishing is. In the integrated care system language, there is a language I quite like, which is, how do we help our people start well, live well, age well, die well? And there's something quite powerful about that framing. But when you start to explore it a little bit further, almost no one in the system of silos in health and care understands what live well, start well, age well, die well means, which means without that deeper insight, and this is a conversation with society, we don't really know what we're trying to do. So it becomes very difficult to convene collective action around those questions if we haven't understood what they actually mean. I just wondered how much that had come out in your work, Tim.
Great question, Andy. Thank you. Christopher.
Great, thanks. I'll jump in. So I just want very quick, to what extent do you think that this is an issue with the NHS and health, and we've forgotten, or at least failed to continue to recognise that it is political? And therefore, to what extent is our failure to take action despite decades of evidence and argument, is it a failure to construct a sufficiently powerful political argument?
Great question. Thank you. Gemma. Yes.
I'm really struck by this notion that of changing the goal of the system and how challenging that is and how to get out of our own way in doing that. So my question is just about the nature of learning, the nature of kind of transformational learning that would need to happen for us to be able to change the goal. And whether your work has touched on the art of play, which is also very supportive of health, but more systemic ways of learning to enable these structural changes to happen.
Tim, maybe 3 minutes, and then I'll just have a
yeah,
minute
great.
to wrap
I mean,
up.
thank you for all those questions. Yes, definitely the art of learning, the nature of learning. I mean, I've been a university professor for 40 years. I know that, there are limitations to academic learning, and in our little breakout group, I can't remember who it was that was saying it, but right at the end, you might even have overheard it as you came back in. We all think too much, and we're not proceeding enough through the heart. Those kinds of messages, I think are really, really important, and they're important for lots of different reasons, partly because they open the space for different kinds of solutions. When we're kind of locked in the brain, locked in this particular way of learning, locked in our institutional jobs, it's not a critique of the people working in them, because the demands, as I said before, the demands are exceptional, excessive, inhuman in many ways. But if you're working inside that environment, how do you lift yourself out of it and have enough space to rethink, to go in a different direction, particularly when you don't have the levers? So, I really agree with what Andy and Paquita were saying, but I was struck by your question, Christopher. Really, have we failed to construct a strong enough political argument? I think in some terms we have. And I think in a way, there are stronger alliances that can be brought to bear now to create this political argument at this point in time. The difficulty for a body like NHS Confederation, for example, that represents the interests of the industry itself, is that it doesn't want to piss off the paymasters. You don't want to go into that all guns blazing, saying, actually, we're doing healthcare the wrong way, and we've been doing it since 1948. But if you just give us more money, then we'll be able to fix it. The Secretary of State for Health is not going to listen to that argument, because he or she is beholden to Treasury, and Treasury is not going to give more money when there isn't more money. So that's not quite going to work. But that's not really what you were suggesting, Christopher. I think what you were suggesting was something more nuanced, and I do think that's where the space lies. We have not created a political argument in a strong enough way. And one of the other people in our group was also making the point about, there are very strong parallels here to bring us right back home for me, which is sustainability, environment. There are very strong parallels here with the environmental issues, that the environmental issues are being driven by this growth at all costs agenda. And that growth at all costs agenda is obscuring the logic of health and prosperity as health. It's obscuring the logic of care. It's denigrating care workers, and it's putting outside of the remit of any healthcare reform that's happened so far all of the determinants of health, which is the only thing that really matters in terms of pursuing that goal as prosperity as health. So it is an impossible situation, but it isn't intractable. And I think that's the important point in terms of particularly that question that you were asking, Christopher, but also the kind of many interventions along the lines of focusing on flourishing, focusing on heart rather than simply intellect, focusing on prevention, focusing on play, focusing on space. The number of examples like that are legion, and they are wonderful examples. But we also, I think, have to have this hard edge, which is about political campaigning and looking for allies in the space to make this case. You, government, Treasury, will not be able to afford playing this game, because it's undermining everything. It's undermining public finances, and worst of all, it's undermining our own health as a nation. And there are real economic and social consequences to that failure. So the time to articulate that argument is very definitely now.
Fantastic. Yeah, on that note, thank you, Tim. Thank you for your sharing your time and your thoughts. And thank you, everyone, for your brilliant questions and